Your gut microbiome is malfunctioning right now, and the symptoms are showing up in places you would never connect to digestive health. The chronic skin rashes that dermatologists cannot explain, the persistent brain fog that makes concentrating difficult, the joint pain that seems to appear without injury, the mood disturbances that antidepressants are not helping, the recurrent infections that suggest your immune system is not working properly. These seemingly unrelated symptoms all trace back to the same source: a disrupted gut microbiome that is failing to perform the hundreds of functions it is responsible for throughout your body. Your gut contains trillions of bacteria, fungi, viruses, and other microorganisms that collectively weigh about 2 kilograms and contain more genetic material than your own cells. This microbial ecosystem is not a passive passenger. It actively regulates your immune system, produces vitamins and neurotransmitters, protects against pathogens, influences your metabolism, and communicates with your brain through multiple pathways. When this ecosystem is balanced and diverse, you experience optimal health. When it becomes disrupted, a condition called dysbiosis, the consequences extend far beyond digestive discomfort. The problem is that gut dysbiosis rarely announces itself through obvious digestive symptoms. Many people with severely disrupted microbiomes have no bloating, no diarrhea, no constipation, no abdominal pain. Instead, the dysfunction manifests through systemic symptoms that seem completely unrelated to gut health, leading to years of misdiagnosis and ineffective treatment, while the underlying problem continues to worsen. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years working in EAN, observed a pattern that has become impossible to ignore. Patients with chronic unexplained symptoms, those who have seen multiple specialists without getting answers, very often have underlying gut dysfunction that has never been investigated. The woman with severe eczema that clears up completely after addressing gut dysbiosis, the man with treatment-resistant depression, whose mood normalizes after restoring his microbiome. The patient with chronic fatigue syndrome, whose energy returns after eliminating gut infections and rebuilding microbial diversity. These outcomes are not coincidences. They reflect a reality that gut health influences every system in the body, and when the gut microbiome is disrupted, the effects radiate outward in ways that most conventional medicine does not recognize or address. My goal is to help you understand the hidden signs that indicate your gut microbiome is compromised so you can address the root cause rather than continuing to treat symptoms that will never resolve until the underlying dysbiosis is corrected. Now, before we continue, I want to make you a promise. I am going to give you the most comprehensive, evidence-based explanation of gut microbiome dysfunction that I can. Everything I share is based on current research in microbiology, immunology, and clinical gastroenterology, not alternative medicine claims or probiotic industry marketing. What I ask in return is simple. If you have chronic health problems that have not responded to conventional treatment, if you suspect your gut might be involved but do not know how to address it, hit the subscribe button right now. This channel is dedicated to helping you understand the root causes of health problems that are routinely overlooked in standard medical practice. If you watch this entire video and you have not learned something that could genuinely change your health trajectory, you can unsubscribe. No hard feelings. But if you give me your attention, I will give you everything I have learned about identifying and addressing gut microbiome dysfunction. So please subscribe now to help this channel reach more people who need this information. Let us talk about the 5 hidden signs that your gut microbiome is destroying your health. The first hidden sign is chronic skin problems, particularly eczema, psoriasis, acne, and rosacea. The connection between gut health and skin health, called the gut-skin axis, is well established in research, but rarely addressed in clinical practice. Your gut microbiome regulates systemic inflammation, immune function, and the production of metabolites that affect skin health directly. When the microbiome is disrupted, several things happen that manifest as skin problems. Increased intestinal permeability, often called leaky gut, allows bacterial endotoxins and undigested food particles to enter the bloodstream, triggering immune responses and systemic inflammation. This inflammation affects the skin, causing or worsening inflammatory skin conditions. The microbiome also influences the balance of T helper cells, immune cells that regulate inflammatory responses. Dysbiosis shifts this balance toward pro-inflammatory states that promote skin inflammation. Additionally, gut bacteria produce short-chain fatty acids through fiber fermentation. These compounds have anti-inflammatory effects throughout the body. When microbial diversity is reduced and fiber-fermenting bacteria are depleted, short-chain fatty acid production drops and inflammation increases. Studies show that people with eczema have significantly different gut microbiome compositions compared to healthy individuals, with reduced diversity and altered bacterial ratios. Probiotic interventions that restore beneficial bacteria have been shown to reduce eczema severity in multiple clinical trials. Similar patterns are seen with acne, where gut dysbiosis and increased intestinal permeability correlate with acne severity. The skin problems are not the primary issue, they are symptoms of underlying gut dysfunction. Treating the skin topically without addressing the gut rarely produces lasting improvement because the inflammatory and immune drivers originate in the digestive system. The second hidden sign is neurological and mood disturbances, including brain fog, anxiety, depression, and difficulty concentrating. The gut-brain axis, the bidirectional communication system between the gut and the central nervous system, is mediated by the vagus nerve, immune signaling, and microbial metabolites that cross the blood-brain barrier. Your gut microbiome produces neurotransmitters, including serotonin, dopamine, and GABA. In fact, approximately 90% of the body's serotonin is produced in the gut. When the microbiome is disrupted, neurotransmitter production is altered, affecting mood and cognitive function. Gut dysbiosis also increases production of lipopolysaccharide and other inflammatory compounds that activate the immune system and trigger neuroinflammation. This neuroinflammation impairs neurotransmitter function, reduces neuroplasticity, and contributes to depression and anxiety. Research shows that people with depression have measurably different gut microbiome compositions compared to healthy individuals. With reduced microbial diversity and altered levels of specific bacterial species, clinical trials using probiotics to modulate the microbiome have demonstrated improvements in depression and anxiety symptoms, confirming that gut health directly influences mental health. Brain fog, the subjective experience of poor concentration, mental fatigue, and cognitive sluggishness, is also strongly associated with gut dysfunction. Patients with irritable bowel syndrome, which almost always involves dysbiosis, report brain fog as one of their most debilitating symptoms. The mechanism involves inflammatory cytokines produced in response to gut dysbiosis that cross into the brain and impair cognitive function. Additionally, dysbiosis often leads to nutrient deficiencies, particularly B vitamins produced by gut bacteria, which are essential for cognitive function. The brain symptoms are manifestations of gut problems, not primary brain disorders. Treating with antidepressants or stimulants without addressing the gut rarely produces complete resolution because the source of the dysfunction has not been corrected. The third hidden sign is immune dysfunction manifesting as frequent infections, autoimmune conditions, or allergies. Your gut microbiome trains and regulates your immune system. Approximately 70% of your immune cells reside in the gut-associated lymphoid tissue. The microbiome teaches immune cells to distinguish between harmless antigens and genuine threats, a process that begins in infancy and continues throughout life. When the microbiome is disrupted, immune education is impaired, leading to inappropriate immune responses. In the case of frequent infections, dysbiosis reduces the production of antimicrobial peptides and secretory IgA that protect mucosal surfaces from pathogens. It also reduces populations of beneficial bacteria that compete with and inhibit pathogenic organisms. The result is increased susceptibility to infections, particularly respiratory and urinary tract infections. In the case of autoimmune conditions, dysbiosis promotes loss of immune tolerance. Certain bacterial species help maintain regulatory T cells that prevent the immune system from attacking the body's own tissues. When these bacteria are depleted, regulatory T cell function declines and autoimmunity risk increases. Research shows that people with autoimmune diseases, including rheumatoid arthritis, inflammatory bowel disease, multiple sclerosis, and type 1 diabetes, have distinct microbiome signatures characterized by reduced diversity and altered bacterial compositions. Animal studies demonstrate that transferring microbiomes from individuals with autoimmune disease to healthy animals can induce autoimmune responses, proving causality. In the case of allergies and asthma, dysbiosis early in life disrupts immune development and promotes allergic responses. The hygiene hypothesis, now better understood as the microbiome hypothesis, suggests that reduced microbial exposure and diversity in childhood leads to immune systems that overreact to harmless substances. The immune dysfunction is not a failure of the immune system itself. It is a consequence of the microbiome failing to properly regulate immune function. Treating with immunosuppressants or allergy medications addresses symptoms but does nothing to restore the microbial balance that would normalize immune responses. The fourth hidden sign is metabolic dysfunction, including unexplained weight gain, insulin resistance, or difficulty losing weight despite diet and exercise. Your gut microbiome influences energy extraction from food, fat storage, insulin sensitivity, and inflammation, all of which affect metabolic health. Certain bacterial species are more efficient at extracting calories from food and promoting fat storage. When these bacteria dominate the microbiome, they extract more energy from the same amount of food compared to microbiomes dominated by other species. This is why microbiome composition can influence body weight independent of calorie intake. Studies show that transferring gut microbiomes from obese individuals to germ-free mice causes the mice to gain more weight than transferring microbiomes from lean individuals, even when calorie intake is controlled. The microbiome also affects insulin sensitivity through multiple mechanisms. Gut bacteria produce short-chain fatty acids that improve insulin signaling in muscle and fat tissue. When dysbiosis reduces short-chain fatty acid production, insulin sensitivity declines. Dysbiosis also increases intestinal permeability, allowing bacterial endotoxins to enter circulation, where they trigger inflammation and insulin resistance. Additionally, certain gut bacteria influence the production of hormones that regulate appetite and satiety, including leptin and ghrelin. Dysbiosis can alter these hormones in ways that increase hunger and reduce satiety, making weight management more difficult. Research demonstrates that people with obesity have lower microbial diversity compared to lean individuals, and interventions that increase diversity often result in weight loss and improved metabolic markers. The metabolic problems are not simply about willpower or calorie balance. They are influenced by microbial composition that affects how efficiently your body extracts, stores, and utilizes energy. Addressing metabolic dysfunction without considering the microbiome often leads to frustration and failure because the underlying microbial drivers have not been modified. The fifth hidden sign is chronic fatigue that is not explained by sleep problems, anemia, or thyroid dysfunction. Gut dysbiosis contributes to fatigue through several mechanisms. It impairs nutrient absorption, leading to deficiencies in B vitamins, iron, magnesium, and other nutrients essential for energy production. It increases systemic inflammation, and inflammatory cytokines directly cause fatigue by affecting the central nervous system and reducing mitochondrial function. Dysbiosis also affects the production and metabolism of neurotransmitters that regulate arousal and wakefulness. Additionally, certain pathogenic bacteria and fungi produce metabolites that are toxic to mitochondria, the energy-producing organelles in cells. When these organisms overgrow, their toxic byproducts impair cellular energy production throughout the body, resulting in profound fatigue. Small intestinal bacterial overgrowth, a condition where bacteria that normally reside in the colon overgrow in the small intestine, is particularly associated with fatigue. These bacteria ferment carbohydrates in the small intestine, producing gas and organic acids that are absorbed and affect metabolism. They also compete for nutrients and damage the intestinal lining, impairing absorption. Studies show that patients with chronic fatigue syndrome have distinct microbiome alterations, including reduced diversity and altered bacterial compositions. Treatment targeting the gut microbiome has shown promise in reducing fatigue in these patients. The chronic fatigue is not psychological or imaginary. It has real biological causes rooted in gut dysfunction that impairs nutrient status, increases inflammation, and disrupts energy metabolism. Treating with stimulants or addressing sleep alone will not resolve fatigue driven by underlying dysbiosis. The mistake that most people make regarding gut health is assuming that the absence of digestive symptoms means their gut is healthy. Gut dysbiosis frequently presents with no digestive complaints whatsoever. The symptoms appear elsewhere in the body, in the skin, the brain, the immune system, the metabolism, but not in the digestive tract itself. This leads to years of treating symptoms in isolation without ever investigating the gut as a potential root cause. The second mistake is relying on conventional stool tests that only detect obvious pathogens but miss the more common problem of dysbiosis, the imbalance between beneficial and harmful bacteria. Standard stool cultures look for specific pathogenic bacteria like Salmonella or C. difficile. They do not assess overall microbial diversity, the ratios of different bacterial phyla, or the presence of opportunistic organisms that cause problems when overrepresented. Comprehensive stool testing using DNA sequencing technology can identify dysbiosis, but these tests are not routinely ordered in standard medical practice. The third mistake is taking probiotics randomly without understanding which bacterial strains are depleted or which are overrepresented. Not all probiotics are beneficial for all people. In some cases, taking the wrong probiotic can worsen dysbiosis. Effective microbiome restoration requires knowing what is wrong with the current microbiome and targeting interventions accordingly. The fourth mistake is focusing only on probiotics while ignoring diet, which is the primary driver of microbiome composition. The bacteria in your gut are directly influenced by what you eat. A diet high in fiber, diverse plant foods, and fermented foods promotes beneficial bacteria. A diet high in sugar, refined carbohydrates, and processed foods promotes harmful bacteria. No amount of probiotic supplementation will maintain a healthy microbiome if the diet is actively promoting dysbiosis. The fifth mistake is not addressing factors that damage the microbiome, including antibiotics, proton pump inhibitors, chronic stress, and inadequate sleep. Antibiotics are sometimes necessary, but they indiscriminately kill bacteria, both harmful and beneficial, and their effects on the microbiome can persist for months or years. Proton pump inhibitors alter stomach acid, which affects which bacteria can survive transit through the digestive system. Chronic stress and poor sleep both alter gut motility, immune function, and the composition of the microbiome. Restoring gut health requires removing these damaging factors, not just adding beneficial bacteria. So what should you actually do if you suspect your gut microbiome is contributing to your health problems? The first step is to recognize the connection between your symptoms and potential gut dysfunction. If you have chronic skin problems, neurological symptoms, immune dysfunction, metabolic issues, or unexplained fatigue that have not responded to conventional treatment, gut dysbiosis should be investigated as a possible underlying cause. The second step is to seek appropriate testing. Comprehensive stool testing that assesses microbial diversity, bacterial ratios, the presence of opportunistic organisms, and markers of inflammation and digestion can provide valuable information about microbiome status. This testing is not typically ordered by conventional gastroenterologists unless there are obvious digestive symptoms, so you may need to work with a functional medicine practitioner or naturopathic doctor who routinely uses these tests. The third step is to implement dietary changes that support microbiome health. Increase fiber intake to at least 30 grams per day from diverse plant sources, including vegetables, fruits, legumes, whole grains, nuts, and seeds. Different types of fiber feed different bacterial species, so variety is essential. Include fermented foods daily, such as yogurt, kefir, sauerkraut, kimchi, or kombucha, which provide beneficial bacteria. Reduce or eliminate refined sugar and processed foods, which promote harmful bacteria and reduce diversity. The fourth step is to use targeted probiotics or other interventions based on testing results. If specific beneficial bacteria are depleted, supplementing with those strains can help restore balance. If pathogenic organisms are present, antimicrobial herbs or pharmaceuticals may be necessary to eliminate them before beneficial bacteria can re-establish. The specific intervention depends on the specific dysbiosis pattern identified through testing. The fifth step is to address lifestyle factors that affect the microbiome. Manage chronic stress through regular practices such as meditation, yoga, or deep breathing. Prioritize sleep by maintaining a consistent schedule and creating conditions for restorative rest. Exercise regularly, as physical activity has been shown to increase microbial diversity. Avoid unnecessary antibiotics and discuss alternatives with your healthcare provider when possible. If proton pump inhibitors are necessary, use the lowest effective dose for the shortest duration and work with your doctor on strategies to discontinue them when appropriate. Let me bring this back to the clinical reality. In the emergency department, I do not typically see acute presentations of gut dysbiosis. What I see are the downstream consequences. The patient with severe eczema who has been hospitalized for skin infections, the patient with treatment-resistant depression who presents with suicidal ideation, the patient with recurrent urinary tract infections who is developing antibiotic resistance, the patient with uncontrolled diabetes despite medication compliance. In many of these cases, when I have the opportunity to explore their history in depth, there are clues pointing to gut dysfunction that have never been investigated. The chronic digestive issues that were dismissed as irritable bowel syndrome years ago, the course of antibiotics that preceded the onset of their chronic symptoms, the diet that consists almost entirely of processed foods with minimal fiber or fermented foods. These patterns are not coincidental. They reflect the reality that gut health influences systemic health profoundly, and when the gut is chronically dysfunctional, the effects eventually become severe enough to cause acute medical problems. Here is the bigger picture. Your gut microbiome is an organ system in its own right, as important to your health as your heart, liver, or brain. It performs essential functions that your own cells cannot perform. When it is healthy, it supports every other system in your body. When it is disrupted, the consequences radiate outward, manifesting as symptoms that seem completely unrelated to digestive health. The modern environment is hostile to microbiome health. Processed foods, antibiotics, chronic stress, environmental toxins, and reduced exposure to diverse microbes all contribute to dysbiosis. The result is that gut dysfunction has become epidemic, affecting a substantial portion of the adult population. But most people do not recognize their symptoms as gut-related, and most conventional medicine does not investigate the gut unless digestive symptoms are obvious. This leaves millions of people suffering from chronic conditions that are rooted in gut dysbiosis, but are never properly diagnosed or treated. Addressing gut health is not alternative medicine. It is fundamental biology. When you restore microbial balance, symptoms that have persisted for years, despite conventional treatment, often improve or resolve entirely because you have finally addressed the root cause. So here is what I need you to do. First, if you found this information valuable, please subscribe to this channel right now. I am committed to creating content that helps you understand the root causes of chronic health problems that conventional medicine routinely overlooks. Gut microbiome dysfunction is one of the most common and most undertreated causes of chronic disease. Second, evaluate your symptoms honestly. Do you have chronic skin problems, mood disturbances, immune dysfunction, metabolic issues, or unexplained fatigue? If so, consider that these might be manifestations of gut dysbiosis rather than separate unrelated conditions. Third, seek appropriate testing to assess your microbiome status. Comprehensive stool testing can provide the information needed to develop targeted interventions. Fourth, implement the dietary and lifestyle changes that support microbiome health regardless of testing results. These interventions are beneficial for everyone and have no downside. Finally, share this information with people you care about who have chronic, unexplained symptoms. Most people have no idea that their skin problems, mood issues, or recurrent infections might be connected to their gut. By spreading this knowledge, you help others find answers that conventional medicine is not providing. Thank you for watching, and I will see you in the next video.